Hi guys, I'm Dr. Daniel Chanchef, and I'd like to thank you for listening to my video, a current update about coronavirus, particularly in Sydney and Australia in July 2020, and what we've learned over the last 6 months. So first of all, the main message of this video is that masks are probably a lot more helpful than we originally gave them credit for. That's the first thing I want to get off my chest. The second thing is that we know that transmission of COVID-19 happens really quick in confined spaces. So though we have good guidelines about keeping a 1.5 meter distance from people and not spending too long in confined spaces with people outside of your household, if you're getting into a lift, if you're in the aisle of the grocery store, things can happen really rapidly. So we want you to use personal protective equipment wherever it's possible and practical to do so. So one other thing about coronavirus is initially we thought this was a respiratory illness, one that caused an atypical pneumonia, and in some people a very severe cytokine inflammatory storm that made it very hard to breathe. And while that is the predominant type of illness people get from this, it's not the only type of illness. And yes, it affects elderly people more than it affects younger people, because generally elderly people have more comorbid conditions and less physiological reserve. They've got less kidney capacity, lung capacity, heart capacity to be able to cope with things. But there's a big gap between respiratory illness and dying and being 100% healthy. So just getting COVID as someone and not being symptomatic doesn't mean you're scot-free and everything's all right. A lot of evidence is coming out now that asymptomatic infections are causing a glandular fever-like syndrome. People develop a chronic fatigue, tiredness, they're constantly sleepy, achy joints, and this can go for 3 to 4 months. And I don't know about you, but with everything that's going on this year, that's the last thing I need to happen to me. So taking extra precautions can be really helpful. In the younger population, we're seeing a vasculitis-like syndrome. Now we're learning more and more about this, but it's akin to something like Kawasaki's disease, where the arteries get very inflamed and they start to damage the organs at the end of it. Eyes, heart, muscles, brain. So, in New York, there was quite a cluster of these cases where some children died as well. So catching COVID isn't all or nothing. There's a big spectrum in between, and it's only been around for less than a year. There's going to be a lot that we're going to learn about it over time. With things like chickenpox, we didn't know everything about chickenpox for many, many years afterwards. And all our viruses that we know a lot about now took us a long time to get there. Science is better, but it still takes time to learn because we've got to see how things happen and things are going to change all the time. So don't get upset if the guidelines and the rules are constantly changing. I'm going to talk a little bit about an epidemiological case. Now, even though studies of a single person are usually not the heaviest weighted in scientific literature, these cases are very important for us to understand how this virus can spread and how PPE can help protect other people from the spread of this virus. So there's a case of a man who was 50 years old in Chongqing in China. He was traveling to his county and then to his final destination, which is a little village. Now this person had symptoms of a cough, but he had not yet had a positive COVID test. He hadn't been tested yet. So he was in a rush. He got on a bus, and this bus had 39 other people on it. And he was on this bus for 2 hours and 10 minutes. And at the end of that journey, he got off and switched at a station. And at that station, he could get a mask. He popped it on, and he caught another bus for 50 minutes. And this bus had 14 people on it too, and he reached his final destination there. Once they figured out that this man had a positive COVID swab when he returned home, they contacted everybody on that first bus, and they found that 5 people had contracted coronavirus, most likely from this person. So they had no symptoms before, they had no other contacts before, this was their only known contact. But the 14 people on the second bus were, as soon as they were found out to have been exposed to this gentleman, they were quarantined. They were tested early in the piece and at the end of the quarantine, and all negative. 14 people, all negative. And the only difference between the two was mask usage. Now, what we usually call this is a crossover study. You try something without the thing that you're studying, and then you try it with the thing that you're studying. Or usually you're trying 2 different things and you cross them over. And it gave some pretty impressive results. The other thing that there's been a lot of contention about is whether COVID is droplet-based, contact-based, or aerosol-based. At the end of the day, it doesn't matter, is my personal opinion. We know it spreads. We know it spreads more than we thought. Initially, we didn't know if human-to-human transmission occurred. It does. We didn't know if asymptomatic transmission occurred. It does. And at the moment, we can't confidently say aerosolized transmission does occur, though there's a lot of evidence suggesting it does. There's no evidence proving it doesn't either. But it's much of a muchness. Droplets are fluid particles that you can really see and things travel within them. Speaking, eating, sneezing, coughing, all those things cause micro droplets to spread. And they can spread up to 2 meters, or if you're very heavily exerting yourself, up to 8 meters. So wearing a mask, if you may be an asymptomatic person, will stop you from spreading it to others. People often say healthy people wearing masks will get no protection from wearing a mask because the virus particle is smaller than a surgical mask or a cloth mask can offer. But most respiratory droplets are no smaller than 5 micrometers. And cloth masks and surgical masks definitely protect against these. This virus, as far as we know, doesn't travel by itself. It doesn't climb up things. It doesn't replicate in the air. So if we protect ourselves from respiratory droplets as much as possible, it will work. Now, a study done in China by Ma et al. Studied influenza, bird flu really, traveling through masks. They're about the same size and the same shape as coronavirus. So it's a fairly good study to see if viruses pass through certain materials. Now, P2 masks protected 99.98% of transmission. Surgical masks protected 97.14% of transmission, but a tightly woven cotton cloth mask in a single layer protected against 95.15% of transmission, which is quite incredible because most of the recommendations for wearing cloth masks are to triple, quadruple layer them. So there is good protection from doing that. A study in the University of Nebraska, they wanted to see where COVID was in the hospital. And to rule out things like contact, people sort of spreading it to each other, in patients who had COVID-19, they swabbed the surfaces underneath the hospital bed, which is something that no one will touch during any course of any hospital stay. They're not going to get under the bed and touch it. And they swabbed the edges of the window sills higher up as well, where people aren't reaching up and touching. And these were pretty much positive for COVID in every situation. They also took air samples of hospital hallways, and 66% of these were positive under reverse transcriptase PCR for coronavirus as well. So it is in the air. Does that mean it's transmissible? We don't know. Wearing a mask will probably stop you from getting it 98.15 or 95.15% of the time. And another study by Zhai et al. Showed that asymptomatic people with COVID compared to symptomatic people with COVID have about the same viral load. So even though symptomatic people will probably be coughing and sneezing, they're also probably going to be staying at home and covering themselves up. Whereas asymptomatic people can still cough and sneeze from their asthma, their allergies, and share food and touch things that we can't really control. It's pretty much human behavior to touch your face. I think in most observations, they found that people touch their face around 3 times every 2 minutes, unless they're consciously trying not to, like I'm consciously trying not to in this video. But it's a relatively common impulsive human behavior. So because we're touching surfaces all the time, hand washing, hand hygiene, and social distancing are still really important, even if we are wearing and using masks properly. So if you do want to wear a mask, but you're not sure when you're going to get the most bang for buck for wearing it, it's when you're about to enter into a confined space. So if you're going to get into an elevator, or you're about to go shopping at a grocery store, or you're going to catch public transport, they're going to be the best times to wear it. Generally outdoors with good ventilation, where you're not next to people, you'll get away without wearing a mask. So if you want to rationalize your usage, that's probably a good way to do it. I'm going to show you how to wear a surgical mask. The commonest one that people are getting are the ones with the elastic loops. And generally they're blue. And if they're blue, the outside of the mask will be blue and the inside will be more of a white color. If it's white all the way around, there's generally some writing, and you can see a little CE logo there. That's easy for us to tell that that's the outside of the mask. As you can see, I'm pretty much handling it from the elastic ends, and I'm very used to doing this, so it's automatic to me, but it can be a conscious effort to do so. What you want to do is place it over your face, over your chin and nose, and place it behind your ears. And since this is a clean mask and we've got clean hands, we can pull down the mask under our chin and pull up the mask over our nose. And as you can see, it's pleated, so it lets us do this. And most will have a firm plastic or metal strip inside they can use to form to your nose. So if you are wearing glasses, this will help prevent it fogging up as much. There will be air coming around the outside, but it's going to be a lot less spraying directly forward than if we weren't wearing a mask at all. Now, if you're going to take off your mask, and put it on again later, it's best that you do the same thing when you take it off. Use the loop handles to take it off and place it somewhere that it's going to be able to hang in an area where it can stay dry and not wet. Don't put it on common shared surfaces like tables, especially if you're at a cafe. And make sure if you are throwing it away, throw it away in a proper rubbish bin. Treat it kind of like a condom. You don't just leave them on tables and throw them around the place. So be careful where you put your masks. If you don't have access to a lot of surgical masks, Dr. Nathan from the Northeastern University Feinberg School of Medicine recommends rotating them. So if you can get access to 4 surgical masks, wear them on 4 consecutive days. Day 1, 2, 3, 4, and on day 5, you'll re-wear the day 1 mask. As long as it's been kept in a clean, well-ventilated area so they can completely dry out, it's expected that most virus will die off this surface in that time frame. If you have no access to surgical masks at all, I'm going to include some links at the bottom to the CDC and the US Surgeon General about how to make cloth masks either out of cotton, scarves, or old t-shirts, which can be pretty handy to do. You just need some rubber bands to do it. If you have access to a sewing machine, even better. So just this last Friday, New South Wales Health made an announcement that anyone in a healthcare setting that sees patients regularly has to wear a surgical mask now and keep 1.5 meter distance. Now, you may be surprised that in July of 2020, this is finally coming out as something that's recommended. But at Green Square Health, we've been doing this ever since we moved from seeing telehealth patients over to seeing patients face-to-face. All doctors, nurses, and staff at Green Square Health wear surgical masks. We offer one to every patient that comes in as well. We don't offer, we make you wear one if you want to see a doctor. And if you're bringing in a friend or a support person, we ask that they bring their own mask from home or they kindly wait outside the clinic so as not to be inadvertently exposed to anyone or inadvertently spread it to other people. We also encourage anyone who's had a history of a fever, a cough, a sore throat, a runny nose, or sneezing in the last 2 weeks to actually do their consult over telephone via telehealth. Now, there's Medicare rebates available for this, just like a face-to-face consult, but you had to have seen one of the doctors at our clinic in the last 12 months to be able to get a Medicare rebate for that. We can still do telehealth consultations to people without a Medicare card or international students or people on insurance, and they don't have to meet that requirement. Or if you do have a Medicare card and you've never seen us before or it's been more than 12 months, we can still do the consultation, you just won't get a Medicare rebate for that. If we do ask you at the front door about these symptoms and it sort of comes to light that you were not truthful, we may have to end your consultation right there due to safety. We don't know who's in the waiting room at any one given time. There are patients who are pregnant. There are patients who can be immunosuppressed, who are going through chemotherapy or on immunosuppressive drugs for their organ transplantation. And it's slightly too high a risk to sort of sneak in and get to see the doctor face to face. We will look after you via telehealth, and if we think you need to come in, we'll arrange a good time when there's no one around. We've got an isolation room ready. We've got a small supply of gowns and P2 masks so we can see you properly if we need to. We're not gonna turf you away. We're not gonna not look after you. We just want to do it in the safest way possible, okay? We don't do COVID testing here because it is an aerosol generating procedure and we don't have the negative pressure rooms or the quantities of swab sticks or gowns or P2 masks to be able to do these at any reasonable volume. So if you do need COVID testing, we will either refer you to one of the labs that does it or give you a list of the public testing facilities that you can go get a test yourself. We recommend anyone who's had any respiratory symptoms at all to go get tested. And it's really important if you do get a test that you stay at home and don't go to work and you self-isolate till that test result comes back. Thankfully, that's within 72 hours. Most of the time it's 48 or even 24 hours. So it's quite a quick turnaround time. But then after that, we ask that you stay home until your symptoms are gone also, okay? New South Wales Health is actually recommending people stay home for 2 weeks after they get respiratory symptoms regardless, but that's not mandated yet. If you can afford to do so, it is a very, very safe thing to do and a very altruistic thing to do as well. If you're coming to Green Square Health with your children for their childhood immunizations or you need your children to be checked out medically, unfortunately, the surgical masks are a little bit big for kids and they don't quite understand how to wear them and how to do it properly. So we don't put masks on them, but we make sure that everybody else is wearing a mask. Now, if your child is very excitable and running around the waiting room, we're actually going to offer you a side room if there's one available, just so they're safe and everybody's safe as well. And we do ask that minimum amount of family members come with you. We understand that's sometimes not possible, and that's okay. We just ask you to make an effort to bring as few people into the clinic as possible. And one of the final things is masks are like diamonds at the moment. For the first few months of this year, they were incredibly difficult to get. Supply chains and manufacture of stock has really opened up worldwide, so we're able to get more and more masks. But now that there's been a New South Wales health mandate, it may become a little bit difficult again. So when you come to the clinic, we do offer our patients a mask to wear. I did notice that a lot of people, as they leave the clinic, will throw it in the bin. I advise you don't do that. Hold on to this mask. Use it when you go outside. Use it on your way home. Use it when you go to the shops or the pharmacy. And if you've got a couple of more masks, put this into your rotation to keep at home as well. Because we don't know what's going to happen with stock levels. People do panic buy, as we saw from the toilet paper debacle. When people are afraid, they want to do things that put them in a feeling of control. And sometimes that doesn't make any logical sense. So it doesn't really make sense for people to hoard hundreds of masks. But it's good to have a supply of some. If we ever come across a good, trustworthy supply of masks, we'll make it available to people. We'll let them know how to get it. If it means that we have to purchase it ourselves and on-sell them, we'll endeavor to do that at a pretty much cost price, just to make sure that people in our community are able to access masks properly. Masks are currently about 20 times the normal price that they have ever been before. The demand for masks is 100 times the demand as it has ever been before. And even though global production is up 40%, it's still not quite meeting the demands of our mask usage. The WHO estimates that in the healthcare industry globally, 90 million masks are needed per day. So it's pretty tricky to be able to, have enough masks on demand. So if you do get into possession of one, hold on to it. If not, make a cloth mask. It seems to work very well. I thank you if you've listened all the way to the end of this video. I really appreciate you guys listening and giving feedback. I'll put all the reference articles at the bottom. I don't like to say things that aren't backed up by evidence. I spent most of my Sunday reviewing the evidence before I said anything. And I'd like to wish you all a very safe remainder of this winter and the remainder of this year. In regards to the government directives about what to do and socially distance, I'm very glad it's been very consistent about keeping our social distance and number of people that should be together at any one time. What I'm not happy about, though, is the guidance for personal protective equipment in the healthcare industry. People in healthcare are exposed to more unwell people at any one time. So they themselves are at risk, but they're also at risk of passing it on to very vulnerable people. I think a lot of the directives around masks have been guided by supply issues rather than best evidence. Now, OHS and W laws have made Australia a very, very safe place to live and work. Workplace accidents and injuries are rarer than they've ever been before and well looked after if they do occur. COVID-19 for healthcare workers is a workplace safety issue. And at Green Square Health, we've taken many steps to make sure that everybody that works here is made to feel as safe as possible. We don't want anyone coming into work and feeling like they're putting themselves at risk. This isn't a war. We're not soldiers. We're not heroes. We're people doing a job. And we want to make sure that everybody here is safe, so everybody we look after is safe. And I think that the requirements for PPE should be more stringent, particularly people working in hospitals. I do have colleagues that run respiratory clinics and they wear respirator suits and masks because they're so much more comfortable, but they cost thousands of dollars. It has been hard to get masks, and I understand the government is trying to do everything they can. And during the bushfires, there was a bit of an issue with supply as well. But I think we should set the standards high and then try to fulfill the supply criteria afterwards, not set the standards based on what we can get. It doesn't seem to make a difference to what people are getting anyway. People who are more risk averse are wearing masks, are wearing P2 masks out in the community, are avoiding other contact as well. So I think that we as a society should be as safe as possible, because the safer we all feel as a community, the more life will return to normal, more normal. We don't know when everything's going to go back to normal or if it ever will. Things might have been changed permanently. The way we work, the way we travel, the way that we interact with each other. I think we're going to be much more aware of hand hygiene for quite a while to come. But what I do know is that when people feel safe, they will then stop feeling anxious about things and be able to do their regular activities, and society will get slowly back to more normal. So it's not about can we get to zero and can we eliminate this, and is it an either or sum of economy versus life? It's not like that at all. But let's do our part to make ourselves safe, our family and friends safe, our colleagues and people we don't know safe as possible, and we'll all benefit from this outcome. I'm Dr. Daniel Chernyshев. Thank you so much for listening all the way to the end. I hope this has been useful for you. If it has been, share it to your friends. Post some comments or questions below, and I'll endeavor to answer all of them to the best of my ability. Thanks again, and I hope you enjoy the rest of your week. Bye.